The broadcast is now starting. All attendees are in listen-only mode.
Hello, everyone. Good afternoon. My name is Tina Karam. I'll be your host for the webinar this afternoon on orthotic therapy for diabetics and diabetic shoe considerations. So first off, I just want to take this opportunity to thank you for registering, for being interested in this topic, and for registering and dedicating 1 hour of your time today with us. It's going to be a great webinar. We have a dynamic, very experienced speaker, Dr. Lustig, presenting this afternoon. And also just wanted to mention that we do have practitioners from different parts of the world. So depending where you are, it might be the morning or the evening, or even the afternoon. So thank you for everybody around the world for joining us today. So as I mentioned, my name is Tina, and I am the marketing coordinator for OHI, and the two brands that I help coordinate are the Orthotic Group and Langer Biomechanics. So I'm sure you've received some emails from me about webinars, about seminars, and if you have any questions, you will have my direct email after the webinar as well, and we'll be sending you some information afterwards. So I just wanted to, first off, if you haven't joined a webinar before in the past, I want to explain a little bit about the dashboard. So you should see a GoToWebinar dashboard on the right-hand side of your screen. And this dashboard is used to communicate directly with myself and Dr. Lustig. So I want to mention that we do encourage questions. We do prefer that you send your questions throughout the webinar, and what we'll do is we'll ask them at the end, just so that we don't disturb the presentation. But anything that comes to mind, you're going to either write it in the question box or the chat box. So you just need to click on the arrow to the left of questions and to the left of chat. That will be your opportunity to communicate with us and ask your questions. So there's different ways you can do that. You can also click on the hand, which just means that you're raising your hand and that you have a comment. So I'll be monitoring that throughout the hour. So like I mentioned again, just wanted to enforce that we love questions. This is your opportunity to communicate with us, ask the presenter questions, and again, we'll be addressing them at the end. So there will be, most likely there'll be some time at the end. If not, I will open the floor for about 5 minutes for questions that come through. But we will do our best to stay on track within the 1 hour, because we understand that you have patients and you have a schedule today, so we'll do our best to finish within the hour. So I think I've covered sort of the administrative portion. One other thing I wanted to mention about audio, if you're having trouble with your audio, if you can't hear, there is an option to phone in and use your device, whether it's a phone or a tablet, to use it as your audio. So what you would do is you would click on the audio arrow, and you click on phone, and it'll give you a phone number and a code. You're going to use that, and that would serve as your speaker. You'd still be able to see the presentation if your computer's working. You just need an audio device. But again, you can communicate with me if you're having any trouble throughout the webinar, and I'll do my best to help. Another thing I want to mention is that we will be sending off the recording of the webinar as well as the presentation after, about 2 to 3 days after. So you will have access to watch the webinar recording again and share it with your colleagues if you wish. And you'll have a copy of the presentation to follow along. So if you prefer to just sit back and absorb the information without having to take notes, we will be providing the presentation afterwards. So without further delay, I'd like to introduce our speaker for the hour. His name is Dr. Alan Lustig, and he is a podiatrist and chief medical director with the Orthotic Group and Langer Biomechanics. He holds a title of both chief medical director and production supervisor for both brands. He actually co-founded the Orthotic Group in 1986, and he graduated from the New York College of Podiatric Medicine. And he's actually been in practice as a podiatrist for over 40 years. He owns and is still to this day practicing at the largest foot orthotic clinic in Canada. And he actually specializes in biomechanics and the treatment of abnormal gait conditions with orthotics and AFOs. So, with over 40 years, lectured over 50 cities across North America on biomechanics and foot therapy. He's the perfect presenter for this topic. And personally, I've known Dr. Lustig for, I would say, over 9 years. I've been with the company, and I've had the pleasure of hosting webinars with him, being at live seminars, and he puts on a great presentation. He's so knowledgeable, has so much experience in so many different areas of orthotic therapy, and so we're honored to have him this hour. So I'm going to actually let him speak now, pass the floor over to him, and he'll get started on the webinar. So I hope you enjoy the presentation. And again, we encourage questions, so please enjoy. Thank you.
Okay, we're set. Slide even works. Hi, everybody. How are you? I hope you enjoy the presentation for the next 45 minutes. It's a very important subject, and it's real important for today because the entire population of North America, if that's what you're practicing, or anywhere in the world, the population is growing by leaps and bounds because the baby boom generation now has turned 65 years old. So many, many more people have diabetes. And one thing diabetics have to be very careful about is keeping an eye on what's going on with their feet. Most diabetics run into problems first with their feet, and if they're not watching closely, some really bad things can happen and not even be noticed. You're looking at a picture here that I remember some of the clinics I was in school in New York City. Our clinic was in a poor area. We had patients come in with literally an ulcer that looks the same as what you're looking at on the screen, and the patient had no idea they were there because their sock had a mark in it. So what we're looking at here is a very substantial ulcer. We want to stop diabetics from getting this. We'll talk about prevention and we'll talk about treatment once diabetics run into ulcer problems. This is sort of a great time-lapse photography over months, literally, just to show what happens when someone develops an ulcer because of obviously a very prominent bony area on the plantar of the foot. It's discovered, the patient is treated properly right away. The ulcer area is debrided properly so that the edges of the ulcer are as thin as possible so they can heal. And this person is put in a custom orthotic so that they can walk, and even when they're walking, the pressure on this very prominent bony area is taken away. This will never heal if this patient did not get a custom foot orthotic made. They can't just walk in a soft shoe or a running shoe or just a soft insole. They literally, and we'll get into it as we go on, they need a custom orthotic that literally has an area cut out to take the pressure totally off the ulcerative area. And you can see over the period of a number of months, and we'll see this again in a few slides, how total healing has taken place. This is really good news because once somebody develops an ulcer, you see it, and is a diabetic, the odds are 1 in 5, 20%, that they're going to lose their leg below the knee. 20% of diabetics who develop ulcers like you're seeing on the left will lose their leg below the knee if you can't get that ulcer healed. A lot of different foot surgeries can be carried out. Once circulation is so bad that the ulcer has appeared, surgery is done, you're lucky to heal that surgery. So if we can heal this ulcer with a special shoe and a great custom orthotic, it's very, very worthwhile. Many diabetics just don't take care of their feet. They just ignore what's going on. If a diabetic patient checks their blood sugar multiple times and adjusts their medication, they are less likely to have complications such as foot infections and lesions. Diligent daily self-assessment of their feet must be an essential part of their routine. Seeing a foot specialist periodically is very valuable. Later on, we'll talk about how our new computerized pressure sensor devices can see problems before they even occur. As with all, I think I might have spelled that name wrong. Out of all foot problems, a poor choice of shoes also is a major problem. Diabetics have to be careful with the shoes they're wearing. We'll get into shoes a little bit down the line. So, number one, we want to prevent ulcers before they happen in diabetics. It's much easier to keep a diabetic going before the skin breaks down. As you can see on the right, this diabetic just has a bad ulcer. You can see it's almost like a corn. It's a punctate ulcer. It's callus right under the second metatarsal head. And if this diabetic doesn't get the proper orthotic, that foot is going to break down. So, besides the proper use of shoes and socks, palliative care is needed. This area has been cut carefully with a scalpel so that the hard skin is as thin as possible. Okay, and then orthotic devices to reduce this plantar force in the area under the second metatarsal head is going to keep this foot from turning from a callus into an ulceration. So besides keeping people from developing these ulcers, our number two job really is by unweighting the plantar surface of the foot while standing and walking to help heal skin ulcers. Once they're developed, we've got to heal them. Showed you this picture earlier. You can see by unweighting the healing area of the foot with the ulcer, they show the healing process over 6 months of treatment. The first picture is an ulcer that's opened up and has been current for a month. Then after 2 months, after 4 months, and 6 months. Without a custom foot orthotic, this ulcer would have never healed with the patient still walking or wearing standard orthopedic shoes. Besides a good orthopedic shoe, they needed a good custom orthotic device inside their shoe. This is a quick research paper, and what happened was 170 patients with diabetes were prescribed therapeutic shoes, therapeutic insoles, and footwear based on the results of a detailed biomechanical study, and they were followed for 2 years. All the patients had a history of foot ulcers, but none had undergone previous orthotic therapy. Before treatment, the reulceration rate was 79%, which is huge, and the amputation rate was 54%, which was obviously horrible. After the study, 2 years after the start of the orthotic therapy study, the reulceration rate was 15%, and the amputation rate was 6%. Quite an amazing reduction in the problems that were going on. For most of my career, I have practiced in a multidisciplinary clinic with partners who are orthopedic surgeons. And when people developed foot ulcers, not only were they treated by the surgeons, but also they were referred to me for special orthotic therapy and for special shoe therapy. So when we got all together, we got the same type of numbers as these. You got to have a group practice that takes care of every possible problem that could occur with that diabetic to get them to heal up. Obviously, in this study, the orthotic therapy reduced peak plantar pressures in patients with ulcerations. Sick leave was reduced from 100% to 26%. Very interesting and very successful study. Once someone comes in, you see them and they have an ulcer like the picture in the bottom left. When prescribing orthotics to decrease the plantar pressure on this spot, it's critical to understand that the larger the surface area which the force can be distributed on the plantar surface of the foot, the less pressure will be applied to this area or any one area of the foot. And you can see that this person's orthotic literally had a molded custom orthotic. The area with the ulcer was marked, and the shell of the orthotic was literally cut away so that there's almost no pressure other than the top cover underneath that prominent bone in the midfoot area. So not just a plain orthotic, but an orthotic with a special addition to relieve the pressure that you see in the ulcer on the picture in the left foot. We want to maximize orthotic surface area when we're making orthotics. So to maximize surface area, an orthotic must conform very closely to the arch of the foot. It must be rigid enough so as not to deform under body weight. Semi-rigid devices are recommended over softer, mushy devices, which just flatten out and don't really redistribute the weight. So we don't want to take full weight-bearing impressions. That's going to give you a much flatter impression of the foot. We want to get the foam to conform to the foot right up into the arch. So a semi-weight-bearing foam impression should be taken sitting, semi-weight-bearing, not standing. It's important that the patient not stand on the foam. We want to get the best arch shape we can, the best neutral position arch shape we can in the mold that we're taking. Off weight bearing plaster casts, if you do that, off weight bearing plaster cast in neutral position also is good because there's no weight on the foot and we're going to get maximum surface area on the orthotic that is made. Just to show you that what a diabetic orthotic looks like, we've got a plastic shell which is flexible, plus maximum cushioning filling in the arch, going up either to the sulcus, full length, or three-quarter. Picture here is a Langer Blue Line orthotic, which I like to use for orthotics because underneath the plastic shell, there's total poron. Poron is our best cushioning material. It gives in any area of the plantar of the orthotic, around the heel, up into the arch. All of this material under the plaster shell is totally flexible, very comfortable, and the best way to make an orthotic for a diabetic patient. Poron is the Orthotic Group and Langer's best cushioning material. It's supportive, but it still gives you great cushioning. This is a picture of a Langer TheraCare soft orthotic. The white material is like Poron, but a little bit more severe and hard. And I would not be making this material for the most brittle diabetics, but for diabetics who still have some sensation on the bottom of their foot, this type of an orthotic is quite acceptable. This orthotic gives support, but also gives, and the arch fill can be cut out in certain areas, and the shell can be cut out to take extra pressure off of very punctate areas in the skin that are being caused by bony prominences on the plantar of the foot. When you treat diabetics, if a diabetic has good sensation, then the last thing you need is really a diabetic orthotic. Regular, normal orthotics like you would make for any other patient is fine. No ulcer, no serious pressure problems. If they've got sensation, our standard orthotics are terrific. The only time you have to go to a really special type of diabetic, flexible, lesion relief type orthotic is when diabetics lose sensation. Once they lose sensation, it's a new ball game, and you have to be very careful with the orthotics you make, because if an orthotic is in a shoe and there's certain areas that are causing extra pressure on the skin, the patient can't even feel it. So once diabetics lose sensation, they need to have really what we call our special diabetic type orthotics. The most common diabetic orthotic designs, our Langer Blue Line is excellent. It's recommended for diabetics with minimal foot deformities, the average diabetic patient, okay, that starts to lose sensation. This is a picture of a 2mm Blue Line module. The soft tissue supplement top cover should be included to give the cushioning a diabetic always needs. So every diabetic orthotic should have a nice cushioned top cover. Okay? Diabetics with total normal sensation can have a vinyl top cover, could have a 3/4 orthotic without a cushion on it. Once sensation is lost, it's also important to have a soft tissue supplement top cover that should be included in the prescription. What you're looking at is a poron covered top cover. The top of it is probably a vinyl, not a vinyl material, but a cloth type material. But the main part of the top cover is poron. So when you're treating diabetics who have lost sensation, it's very important when you're building their orthotics to have some type of poron top cover. Plastizote is a commonly used material in diabetic orthotics, but I find that plastizote is very temporary and does not hold up very long to absorb pressure. Most plastizote, unless very thick, will bottom out and lose its cushioning within 2 to 3 months. I want my diabetic orthotics to last sometimes upward of 2 years if we're lucky. So plastizote, which is very commonly used in the industry, is great when it's new, but it very quickly bottoms out and you lose the cushioning under bony areas that are pressing too much on the plantar surface of the skin of the foot. It's very careful when you're dealing with diabetics, okay, not to limit toe box height. If you fill up if you fill up a shoe with too thick an orthotic, the area, the toe area of the orthotics foot could be under too much stress as far as friction. So this is a 4-foot extension warning. In instances where extra poron is needed to thicken the forefoot metatarsal area cushioning due to significant forefoot fat pad atrophy, this extra poron should be extended from the distal edge of the orthotics only to the sulcus. It should not continue under the toes. The thicker part of the forefoot cushioning under the front of the foot, from the metatarsals to the toes, should not continue under the toes, or if it does, be very thin. We do not want to crowd the toe box of the shoes. Extra room above the toes is always important because we don't want the top of the toes to be rubbing the top of a shoe. And as you can see at the picture at the bottom, there's a regular Florsheim, regular good walking shoe, an orthopedic shoe. The shoe next to it is an extra depth shoe. Very, very significantly different. You can see how much extra depth there is in the toe area of this shoe. Anybody who's a brittle diabetic who has lost sensation, you don't want their toes to be rubbing the top of the forefoot of the shoe. It's important that you look into extra depth shoes. There is a significant difference. Often the extra depth shoe can really save a diabetic patient from losing a foot. So not only do we need carefully made orthotics for diabetics, but once a diabetic loses sensation, they need a special shoe design. And what it's called is extra depth shoes. Just showing a typical foot that may have problems with shoe fit. A diabetic with a bunion, they have a hammer toe. The toe is on top of the first toe. A regular shoe could not accommodate this foot. An extra depth shoe is absolutely necessary. The picture on the left shows the toes, a full-length orthotic, and if I was adding for this foot cushioning for under the ball of the foot, it would be in the red area and would end and thin out before the toe area. If you try to put a thick 4-foot cushion from the end of the distal end of the plastic of the orthotic to the end of the toe in a regular shoe, this person is going to break down the skin on top of their second toe. This person absolutely must have a special extra depth shoe. As you can see by this series of pictures, if this person's a diabetic, without a doubt, under, let me just point here, under the third med head, which is plantar flexed, which is prominent, where a regular patient would develop a callus, okay? A diabetic patient is going to develop a callus and then break down, the skin will break down, and an ulcer will form that may go right down to bone. So before this happens, if this is a diabetic patient starting to lose sensation, what we want to do is put a metatarsal head cutout on the orthotic for this patient. In other words, this orthotic with a metatarsal head 3 cutout will unweight the pressure under the plantar flexed third metatarsal. This metatarsal has to take the most pressure as the foot hits the ground. It's the first prominent metatarsal head that hits the ground. It needs to be accommodated, and in a diabetic orthotic, not only do you need a nice cushion on top of this orthotic right to the toes, but cushion under the ball of the foot, and this is called a third metatarsal head cutout. Either TOG or Langer can do this. It is very effective in taking a diabetic with a foot that looks like this to be able to walk and not break down that area. That skin will not break down once the foot is accommodated with a third metatarsal head cutout. As we mentioned earlier, to take pressure off of certain parts of the plantar of the foot, we want to have as much surface area on the orthotic as possible. And in brittle diabetics, a deeper heel cup adds surface area to orthotics. A standard heel cup in an orthotic is 8 millimeters. If you want a patient to have a deeper heel cup to make sure that more and more pressure is taken off the midfoot or the area at the ball of the foot where the metatarsal heads is, a deep heel cup option with an increased depth of 16 millimeters will take even more pressure posteriorly towards the heel and get it off the arch area and the forefoot. A deep heel cup makes the orthotic shell a little wider, so the patient has to be a little bit more careful with the shoes they're wearing. But someone who's a brittle diabetic and has a foot that looks like this really needs a really special orthopedic shoe. And what we're looking at is pictures of some of Apex's stretchable upper extra depth shoes. Part of the OHIP group is the Apex Footwear line, and they have spectacular diabetic shoes. If you've got experience in treating diabetics, you'll love the Apex shoes. This is one of the more obviously severe feet you're ever going to see. And the shoes on the left, both, the uppers are flexible, okay? Area is made out of nylon. There's no leather uppers. At the top of this shoe, not only having extra room to it, gives and stretches, and these are the shoes that really the most brittle diabetic needs. These are available from Apex. Anyone who has a foot that, if you look at it, it's really, you'd consider deformed, okay? These are the type of shoes you need. Number one, the Apex stretchable upper extra depth shoes. In general, diabetics do great with good stability running shoes. They're quite roomy. They have great toe boxes. So for diabetics, and one of the best shoes you can get is the Brooks Beast, which is available through TOG. Okay, it's an excellent toe box, excellent support, lots of room for a custom diabetic orthotic. If you've got a diabetic who has serious foot problems but wants to exercise or walk a lot, this is a great choice. Okay, Apex also has some terrific running shoe type, flexible shoes with lots of toe box room, but this is one of my favorites. The Brooks Beast, great support, great to fit an orthotic in here, and terrific extra toe room just in case this patient has hammer toes or you want to make sure that the top of the running shoe is not rubbing on the foot. As I mentioned earlier, once sensation is lost, shoes get to be much more important. Once a diabetic doesn't have any feeling in their feet, it's time to look at Apex shoes, and you'd be surprised. There's a great variety of shoes, all extra depth, all with extra movable insoles to give even more room, and some of them, like the shoes on the right, look very, very acceptable to diabetics who want to get dressed up or want to wear a suit or go to work every day. These shoes not only look good, but are comfortable and have the extra depth necessary to fit a custom diabetic orthotic, plus extra cushioning to keep a diabetic's feet as in good shape as possible. Apex shoes have extra depth. They have excellent midfoot and forefoot stability, so the shoe doesn't break when it bends and cause problems on the dorsum of the foot. They all have excellent shock attenuation. They come in nice wide last designs. All Apex shoes come in 3 different widths. And the shoes, most importantly, come with multiple removable layers, 1 or 2 soft linings that can be taken out of the shoes to give a custom orthotic more room, or to be left in if there's enough room to give even more cushioning to the custom orthotic. A big, big plus for Apex shoes is almost all of them have multiple removable layers to give custom orthotics more and more room to do their job. This is very important. Apex shoes have 3 different lasts. If you have the catalog, they're listed as the X last, the V last, and the A last. And they mean something, okay? Some people need more motion control. Some people need a bottom, like the V last, that has an aggressive lug design for added traction in case some of your orthotic patients are slipping or falling, or sometimes say that they really need more traction. The A last is the group of Apex shoes where all the shoes have a more natural, flexible motion. They're just not quite as supportive, but they have more motion and bend available, especially at the ball of the foot. They're lighter weight. The tops are softer. So the 3 lasts cover almost every condition you can possibly come upon. Very, very valuable to have this choice. For many diabetics, it's important to have Velcro straps, and many of the Apex shoes have that available. They have a lace model, and they also have Velcro strap models. A lot of the Apex shoes have Velcro straps. As seniors get a little bit older or they're diabetic, have trouble bending down, the Velcro straps are very, very valuable to be able to get as part of the shoe to prescribe to them. All of the Apex shoes have excellent traction. That's part of the attention that is made in designing these shoes. They have slip resistant soles. They're called Smart Grip polyurethane soles. Very important. Obviously, you don't want any seniors falling, and by having anti-slip soles, you got another plus in your favor. And as we've mentioned many, many times, all the Apex shoes are capable of accepting custom foot orthotics. This just shows you the available widths in the Apex line. Almost 5 or 6 widths in different model shoes. Not all the shoes have these many, but most of the shoes have at least 4 different widths. The Apex shoes on the bottom, every single dressier style has 3 widths, medium wide and extra wide. And as you can see, extra wide is a 6C for men or a 4E for ladies. Very significant. Diabetic feet with bunions or hammer toes, you need that extra width. So very few kinds of shoes you can order. Very few shoe companies have this amount of fitting availability to their shoes. They're all available through the Apex catalog. As we mentioned earlier, some of the shoes, even though they're extra depth, are quite nice looking, very attractive, and still available in at least 3 different widths. Very, very valuable to be able to have that many widths available for diabetic feet. Just a few facts. If you're treating diabetics these days, diabetes is responsible for 50% of all non-traumatic lower extremity amputations in the United States. And you can see the number of amputations. When it comes to diabetics, once a diabetic breaks down and has an ulcer, the odds are greatly that they're going to lose their leg, at least 20%. The incredible cost of an amputation. If you can prevent this with orthotic therapy and great shoes in diabetics, it's very, very valuable. Obviously, 90% of diabetics have peripheral vascular disease, so not only is their circulation bad, but they lose the sensation in their feet. 50% of diabetics have peripheral neuropathy. If in your practice, if you're seeing a lot of patients, if you're seeing a lot of diabetic patients, if you're doing orthotic therapy, okay, in order to walk a patient over a pressure plate so you can see the different areas of maximum pressure, so you can design an orthotic to take the pressure off of these. You can see in this test on the left-hand picture is a diabetic walking barefoot. And then the same diabetic with an orthotic in their shoe with an in-shoe pressure sensor showing how the pressure has been redistributed mostly into the arch, into the rear of the foot, and how much less the pressure is on the ball of the foot. You can see just how much you can adjust the amount of stress on the skin of a diabetic. I mentioned baby boomers before, 1946, 65 years older and older. Many, many more people have diabetes now than ever before. People are getting older. It's an important part of practice to know how to treat diabetic feet properly. And in your clinic, a TOG gait scan is a very valuable part of diabetic foot care because you can walk a diabetic across the pressure plate before they ever have a problem, and you can be able to see plantar pressures that may be coming or already there, and then lead yourself to designing orthotics to take the pressure off the plantar of the foot. Incredible detail of plantar pressures. You can see if this is your patient, the 5th med head, this person immediately needs the 5th med head unweighted and the 1st med head unweighted. And this is the type of results you would see when someone walks across the gait scan. Two-dimensional picture pressures. If these patients were diabetics, you know immediately where to keep an eye out, to check carefully for increased callus production or increased pressure that's going to produce a plantar corner or callus. And you can see where, if you're making orthotics, an orthotic has to be blown out or a submetatarsal adjustment made for the diabetic walking on their new orthotics. So it's very valuable to see potential pressure problems, especially in diabetic feet. If you've got the opportunity to check out the gait scan system, if you've got a practice where you're seeing a lot of diabetics, this is absolutely essential. I hope you've enjoyed the presentation. If you have any questions, I'm happy to take your calls. Tina's going to give you my cell phone number. If you're a TOG or a Langer customer, I'm happy to take your cell phone calls and do a consult with you. Once I take a call, we can even deal over the internet. You can send me pictures of your patients if you're not sure what type of an orthotic to order from the lab. Be happy to help you out. It's been a pleasure speaking to you. See you next. My next webinar is December 5th.
Mm-hmm. Thank you, Dr. Lustig. Thank you so much for the valuable information. Great presentation. We hope that you've enjoyed listening in for the hour. We do have some time for some questions. I do see one question that's come through. What are the options to order Apex shoes through TOG for the Canadian group? Yes, definitely an option to order through Canada.
I do.
Yep. Yeah, Dr. Lustig orders a ton of Apex shoes. We already have Canadian customers ordering right now. I'm going to send you how you can, so first what you need is an Apex account. So anyone that's a TOG or Langer customer would need to open a separate Apex account, and it's very simple, very easy. I will send you some of the details in an email, and then you can communicate with me directly, and I will put you in contact with the exact person who's going to set that account up and help you.
Prices are very reasonable.
Mm-hmm. Yeah, exactly.
Checking this out. It's very reasonable.
Yeah. Dr. Lustig just mentioned that, of course, the pricing is very reasonable in Canada. I will fire off a price list to everyone for the Canadian price list, as well as I'll connect you with the U.S. information as well, because we do have some U.S. customers on the line. But they're fantastic shoes, as Dr. Lustig mentioned. There's a ton to choose from. Very accommodative, and a lot of amazing features for diabetic patients.
Great catalog.
Mm-hmm. Yep. And the catalog I will attach to the email as well. There are a couple options. We do have some time, so I'll just mention that there are a couple options for the catalog. We have a full catalog with everything in it, and then we have also a mini catalog with a snapshot of the popular shoes. You have an option for your clinic to keep there, and then you can also hand out, the mini version to your patients. And we have a lot in stock. You can keep a good bunch in your clinic. If you need any of that information, I can ship you some marketing materials. I'll mention all of this in the email. So if you need anything specific, Apex related or TOG related, to help market in your clinic, to help educate your patients, we have all of that information available to you: brochures, catalogs, information sheets, posters, that sort of thing. Just going to skim here and see if I can see any other questions. We have another question that's come through about options for blue line orthotics, Langer orthotics, for Canadian customers. Absolutely. We have definitely, you can order the blue line or Langer orthotics using your Langer Canada account. I will include that in the email. It's a fantastic question. So if you are a TOG customer and you want to try a Langer orthotic, whether it's for a diabetic patient or any other type, sports, casual, active, I will send you that information if you don't have a Langer account, because that's how that's what you will need to order Langer orthotics. There's quite a selection in the Langer side as well as the TOG side.
They're made here.
Yeah, and we manufacture, thank you for reminding me. We do manufacture all of our orthotics, both Langer and TOG, at our office. We have a 70,000 square foot office here in Markham, Ontario, and this is where we make all the magic happen. We create all of your custom orthotics in our lab here in Markham, here in Canada. Did you want to add anything else, Dr. Lustig? Well, I'm just looking for some questions.
Important to get a hold of the full Apex catalog.
Right.
That's
yes.
the biggest.
Absolutely. Just to reinforce for the catalog, it is quite a nice, informative, detailed catalog, sizing, colors, styles, nice pictures for your patients that you can show your patients so they have a visual. It's great to have a digital copy of a catalog. Of course, we're in 21st century. This is what everybody's doing, going online, checking things out. But it's also nice to have a paper copy. So for those customers who are not so tech savvy, we do have a nice catalog that you can provide them. And we will ship those catalogs to you so you have copies in your clinic in the waiting room. Another question has come through. Will the TOG website for footwear in Canada also try to improve to meet the needs of these feet? Absolutely. We're actually in the process. Of course, we have over 200 shoes, or sorry, not over 200, over 600 shoes to choose from on the TOG site. And we are working on expanding that collection, especially in the orthopedic, on the orthopedic side. And we do understand that is a gap, and we're working on improving that collection. In the meantime, as mentioned, open an Apex. I would encourage you to open an Apex account because the orthopedic shoe collection is quite good. And as Dr. Lustig mentioned in the presentation, there's accommodations. They're flexible. They're and highly recognized by most insurance companies.
Yes, that's an important comment. Canadian insurance companies, Apex is golden.
So a preferred orthopedic company is the insurance companies are they do have Apex. Most of them, majority of them, have Apex on their preferred list. So it is well known. It's been around. So there will be no problem in that. But yes, to answer your question, we are working on improving our orthopedic line for the TOG side. But in the meantime, you can open an Apex Canada account. Thank you for those questions. Very valuable, important questions. And just wait a couple more minutes to see if anything else has come through. And if you think of anything after the webinar, you can email me, and I work directly with Dr. Lustig, or I'm going to be including his direct cell number and email address. Just to mention that usually with larger companies, it's hard to get through to a doctor or an employee on the board. I mean, I find it very difficult if I ever have to reach an association. It's usually you go through someone to speak to that person. But you have the luxury of calling Dr. Lustig, emailing him directly, and speaking to him. He will answer his phone. It is his cell phone. It's him that answers. It's not a secretary or anyone. It's him directly. So he also will accept images if you want to send pictures, images of your patient's feet for a consultation and for his advice. He will gladly look at those images and help you. Email. Yes, I will be including an email and phone number for you. So we're here to support you. We're here to help you and your patients. And I hope that concludes the webinar. I don't see any other questions that have come through. That completes our webinar. I hope you enjoyed it. I hope you enjoyed the afternoon time. And you can go back to your patients and tend to them and help them. But thank you so much, everyone, for attending. And we hope to see you online soon. Tomorrow, just want to mention, leg length discrepancy with Dr. Ross. 7:30 to 8:30 p.m. Eastern time. We're ending our season with that one, as well as Dr. Lustig is presenting orthotic therapy for specific and common sports. And that's on December 5th from 7:30 to 8:30 p.m. Eastern time. Thank you so much, and enjoy the rest of your day. Bye.